Yeah, so in this analysis of Elranatamab post other BCMA therapies, we've pooled different trials. So there is the MagnetisMM-1 and MagnetisMM-3 trials that were pooled to look at all the patients who had received prior BCMA treatments and who were receiving Elranatamab. I think it's a very important question because today the question of sequencing those immunotherapies is more and more important while we have in clinical practice more access to those immunotherapies. What we see here is that the response rate is a little bit lower in patients who receive prior BCMA treatments. It's about 46% of overall response rate for the whole cohort, as what we know for patients naive of BCMA treatments, the response rate is more about 60%. So as for teclistamab, we see a little drop in terms of response rate. But what's interesting is that there are patients who receive prior CAR T cells and patients who receive prior ADC, antibody-drug conjugates. And actually the patients who receive prior CAR T cells have a higher overall response rate, close to 50% in this situation. So the drop is less important for patients receiving CAR T cell first and then bispecific antibodies as opposed to ADC and then bispecific antibodies. So that also helps to guide the sequencing of the patients in real life, and perhaps with the indication that we have, receiving CAR T cell first and then bispecific antibody would be so far the way to go with the data we have.